Okay, let's talk a little bit about mid-back pain, whether that is up by your shoulder blade or it's kind of down here right above your low back or going up into your neck. There are a lot of things going on. There's a lot of structures involved. And typically, generally speaking, the body is very dynamic, and it's very rare that it's one exact muscle that is at fault unless you have a very specific injury to that muscle. So what I wanted to show you is an overview of what's really going on back here. So you've got the big muscles that you generally see on like bodybuilders or really fit, lean people, where you can see that kind of taper down of their traps. You can see their lats. You might see some of the different shoulder muscles in there. But a lot of times people don't realize how much is actually underneath that as far as other muscle layers. So when you take off one layer, you can see the rhomboids. Okay, that's responsible for pulling your shoulder blades back, tipping your shoulder blade a little bit. You can see levator scap, which helps to rotate your shoulder blade, helps to turn your neck. Okay, then we take off even more layers, and you can start to see more of the serratus muscles. So you've got your serratus posterior, superior and inferior. You don't have to remember any of these words. I just want to point them out to you. But let's take off another layer and really take a look at this entire group is referred to as the Erector Spinae muscle group, but there's actually a series of different muscles that are in there. So you'll see there's a couple different groupings that actually make up the functioning of what holds you up, what extends your back, things that can get irritated. But if you'll notice, they span all the way from tailbone all the way up. So you've got a few that tend to get more irritated in the neck area because they don't actually go quite as low. Let's take off another layer. You can see, let's see this guy. Actually, let's go one more layer down. So if you look at your multifidus muscle, that is the deepest, one of the deepest muscles of the spine area. That sometimes it is either that it's just not turning on enough. We either slouch a lot and we're just kind of hanging out on our ligaments, or we maybe are just not very active and it doesn't get as strong as it needs to be. And then if we take off one last layer, you can see these teeny tiny little muscles that are actually in between your vertebra. It does help to use, like to do motion, but it actually is stabilizing. So oftentimes with things like muscle spasms, they are either going to happen because the muscle is overworked to the point of exhaustion and it can go into a spasm, or it's overstretched and a little bit weak in a sense of it's trying to function in a non-optimal position. Generally speaking, if you look around at the general public, when they have what we think of as poor posture, they tend to be rounded in their upper back, and they actually end up hanging on some of these ligaments that I will show you in here. Take off that one. So if we actually take a closer look in here, there's ligaments all in between the levels of your vertebra. They're in between our spinous process, and they're actually between the vertebra on the front and the back side. So if we actually spin this guy all the way around, you can see through the rib cage that you actually have a long band on the front, and then you have a long band on the back, inside the spinal column also. So when you are not activating your muscles and you're just slouching, you're hanging on ligaments, you're kind of overstretching some of the muscles that are intended to help stabilize you and keep you upright, which sometimes can kick into a spasm, sometimes can just lead to that general tension feeling. You also have loads of nerves that live in these areas. Okay, so if we start adding in nerves, you see how it starts to be hard to pinpoint exactly one thing that's going on. So I like to take a global approach, but specifically when we have pain in these areas, when I use modalities like dry needling in addition to therapy, it is because you can get to these really deep muscles and have an effect on these really deep nerves better than I can with just my hand or with foam rolling and things like that. Now, the ultimate solution is always going to be figuring out how best to strengthen and to move correctly, but sometimes adding in things like manual therapy just aids in that process. So places that people tend to get a little bit of irritation will be over here near the shoulder blade area. You can see some of these nerves that are near there. They can get irritated. They span up into the neck. They can come down in here. And there's also referral patterns from the low cervical area. So if something like disc area or pinched nerve, it will actually refer to this area also. So you've got to take a global approach. You've got to get things moving well, desensitize the nerves, get the muscles with blood flow going, get them working and firing appropriately to help prevent things from coming back in the future. So stuff like pain medication and muscle relaxers and injections, they will give you temporary relief, but they actually don't get to the bulk of what's really going on. So that's an overview of the mid-back. Just wanted to put it in perspective how much is really going on. So hopefully that's helpful for you.